Hey there, I'm Camille Bang, Fractional Chief AI Officer and founder of the AI Adopters Club. I help leaders move from AI hype to outcomes. And today we're looking at AI in medicine where the stakes are life and death. My guest today is Steve Brown, a Silicon Valley technologist and AI architect. During his own health scare that he will probably mention today on this call, he built an AI system to analyze his medical data after multiple specialists had misdiagnosed him. His system flagged possible marrow dysfunction, led to a bone marrow biopsy, and uncovered a rare cancer that I'll let him pronounce himself before I mess it up here. But that system essentially grew into what's called CureWise today. It's a full stack agentic medical AI that now supports real patients and works alongside centers such as Mayo Clinic, UCSF, and UCSD. Steve, welcome and thank you for doing this with me. How are you doing?
I'm doing great. It's great to be here.
Yeah, thanks for being here. So, my first question, when you hear me describe CureWise, how would you respond to that? Is that accurate? How would you describe it yourself, if you will? And how was that cancer called? How would you pronounce that?
Well, I mean, I have a rare variant of multiple myeloma, which is starts in your bone marrow, and mine, instead of doing what bone marrow is supposed to do and make antibodies, it was making a misfolded protein that can clog up my organs and cause heart failure and kidney failure and all kinds of bad stuff. But I was lucky that I got it, I say, just in time before it had done a lot of damage. But I was very, very eager to figure out what's the best possible treatment for what I have, because what you normally get is you get standard of care, which is what worked on average for what worked best on average. But most people are not average. Most people have, and with cancer, I mean, everybody's cancer is different. And there's a massive amount of development in this field it's called precision medicine, because it's not just your genes and your test, it's the genes of your cancer. And those are there's variations in there that could reveal unique vulnerabilities and different treatment options. But this is the kind of the new frontier of oncology, but it's not that widely distributed yet. I mean, it's if you go to Mayo Clinic like I did, and you go to UCSD like I did, and you go to UCSF like I did, people are on the frontier, and you're going to get something that looks like precision medicine. But if average person going to their average doctor is probably going to get kind of the default is just the standard of care, and it might be great on average, but it might not be the best thing for you. And it's hard to know. How do you know unless you really become an expert in your own disease?
So tell me, how did you become an expert, and what was the starting point, or maybe the breaking point where you decided, okay, I gotta work with AI to figure it out because I this is not enough for me. What was that process, and when did you decide to start with that?
Well, I've been working in AI for a while, and I'd been doing a whole bunch of, I'd say, innovation in AI of multi-agent mixture of agents and models, and creating agents that would debate each other, and creating lots of different points of view and looking for synthesis. I was kind of creating these methodologies for mining the knowledge that's in these huge black boxes of these foundation models. As you know from using AI yourself all the time, that depending on how you ask the question, you might get a different answer.
Hmm.
In medicine, that's not super reassuring if you get a different answer depending on how you ask the question, or if the AI is trying to, make you happy or whatever. That's like, no, you want to get closer to something that is true for you. You don't want it to make stuff up. So when I was looking at the challenge of just what's going on with my health, I recognized in the real world, I had a bunch of different doctors and they had a bunch of different opinions. And that doesn't mean that they were hallucinating. It just means that it's complicated, and there's a lot of uncertainties. But when you get a bunch of different opinions and then you look for kind of agreement and disagreement and you look for new ideas, it's very helpful. If you can kind of synthesize that and dig deeper, it's very helpful to get multiple opinions. So I looked at with AI, the kind of the same thing. I created AI agents with lots of different points of view, initially kind of modeled on my own doctors. And they had different opinions. But then I'd have them kind of argue with each other and like, hey, you all have different opinions about what's going on here. How can we settle this argument? So in that process of mixture of agents and models, because I was also doing it with different models, because different foundation models have a different compression of the world's knowledge. But when I do that and get different points of view and look for convergence, look for new ideas and then look for convergence and kind of do this back and forth between like, let's make sure we've looked at all the possibilities and then let's kind of cross-validate and look for synergies and convergence. That was the process that I was doing. And that process got to much better results. So when I did it with my own medical record before I was diagnosed, I basically got, we lived in Malibu. Had doctors in LA. I was being misdiagnosed for a while, like it often happens in cancer because things, there's things are sort of ambiguous, but it's sort of described as a fishing expedition, and maybe it's just stress or indigestion. Turned out to be something extremely serious, but they didn't catch it in LA. But when I got displaced because of the fires in LA, and I ended up in Rancho Mirage, California, in the health system there, it was a new set of eyes, new set of data, looking at it and saw things in a different way, and dug deeper and got a diagnosis. What I did, the first thing I did, and the first thing I asked of the AI is, why didn't they catch this sooner? I had everything. I thought I had everything tested. I had hundreds of tests, like test everything. I had the full body scan. I had all the stuff. And so I did my kind of multi-agent approach, and I had 5 different opinions on what it might be from my old data. But what they all agreed on is they said, Steve, to settle our argument, you need to ask your doctor for this other test. And it turned out to be the one test that I needed, that if I had known that a year earlier, I would have gotten diagnosed a year earlier. If you don't know it, you don't ask for it, you're going to get whatever the doctor thinks of at the time, or whatever's in the kind of the checklist that they have. But if you know more, you ask better questions. I would have gotten that test if I'd known to ask for it, and I would have got diagnosed a year earlier. Luckily, I got diagnosed just in time. It was like, cancer's like this exponential. It might be growing exponentially, and it looks flat for a long time, and then it goes like this. And I was just lucky that I caught it just in time. But then I was, so that's diagnosis. Then I'm eager to figure out, okay, what are the treatment options? I had all these biopsies. They sent, for genomic testing, molecular profiling, they sent this off to the Mayo Clinic. And I had like this 15-page long report, this big TIFF file as an attachment to my chart. And, my doctors didn't really talk about it. It's like, well, look, you have this, you're going to go on this treatment plan. But I started digging into this kind of new wave of diagnostics, into the genomics, and I realized, well, I don't have the average version of this. Is the average standard of care treatment the right thing for me? And it turns out the average standard of care treatment was not the right thing for me. I had specific mutations in the cancer that made it particularly vulnerable to a different drug and less vulnerable to the one I was on. So, I could see in my data that it was like starting to plateau. I wasn't going to get a complete response. And so I went to the Mayo Clinic, and I said, I'm here for a second opinion, not to my other doctor, but to my AI. And I went to UCSD and UCSF and went to top people in the field. And pretty much they all agreed that, yes, this is, this would be a good idea for you to try this other drug. This other drug, it was off label. It's not approved for my disease because it's too rare. For, no one did a clinical trial because it's just too rare. So, I'm on a particular combination that one of my doctors was about to enroll for the first ever phase 2 clinical trial on the combination, and he canceled the trial. And I'm like, I need to talk to this guy. Why did he cancel the trial? And he canceled the trial because he couldn't get enough patients for the phase two clinical trial, not even a
Mhm.
randomized control trial, but just a phase two trial. This is the challenge of precision medicine and the role of AI in it is that 1 million people have cancer. It's 1 million different genetically unique diseases. Someday, those 1 million people probably need to have their own customized, optimized cocktail that's the right thing for them based on the very particulars of the genomics and molecular profile of their specific disease. And that's a really complex problem to solve. Today, there is a lot of precision medicine out there. It's just not that widely distributed. If you go to a top center, you're going to get a lot closer to it. If you go to your kind of, the community oncologist, chances are you're going to get like, you have this is what we do. So when I started building this app, this kind of agentic AI application that involves importing my medical record, lots of different medical points of view and kind of synthesizing results. The first thing is help people understand what's out there. Help people understand what they should talk to their doctor about. What should they ask for? That's the starting point, is just kind of increase access to what's already available, matchmaking between your genomics and what all the new treatment options are. With the human in the loop being your doctor. This is your doctor's going to diagnose and treat. But if you're going to be sharing in that process, you got to get educated.
Mm.
So that's the kind of starting point, is just help people understand what's possible, and have a better conversation with their doctor. Where does this go over time? It's like, what makes cancer complicated and unique and actually interesting is it's like its own organism that's decided, I don't want to be part of the whole anymore. I'm going to go take my own evolutionary path. So it is evolving and it is changing. And it's not just like, what are the genes of that cancer today, but where's it going to evolve next?
Mm.
Like this is a really hard nut to crack. It's a ton of data. It's going to need a lot of AI to like anticipate the evolution. So that cocktail might be like, hey, if we put pressure on this thing, that's great, but it's just going to do this workaround. So what are all the potential workaround? Let's hit those all at the same time. Like
Hmm.
that's how we're going to knock this out. So you can see the pathway to curing cancer is going to be increasingly precision medicine until it's exactly the thing that you need without all the collateral damage. So
Yeah.
that's the project, working on that.
Gotcha. And yeah, I always say that too when it comes to an educational context, that I love that AI makes the unscalable scalable, and in a sense it does that in medicine as well. That's a beautiful example. Now, obviously, without saying, nothing here is medical advice, and we're talking about currently your personal
Mhm.
case and the future of patient side AI. And I think you guys are in a closed beta right now. But from your side, how would you say should people think about these types of conversations with AI, and how should they interpret them? We get mixed signals. On one side, you hear people saying that in the future, no doctor will be allowed to give a diagnosis without consulting AI, right? On the other side, you hear ChatGPT, I believe, OpenAI just restricted the answers for medical advice and legal advice, I believe, as well, when it comes to asking ChatGPT. So there's like two different sides of the spectrum. And on top of that, how does the person in the loop supposed to interpret any of that? What's your thought on this type of conversation?
Well, like you said it just a minute ago, I mean, CureWise is not giving medical advice either. I mean, we are not diagnosing or treating anything, but we are helping educate you on what does all this stuff mean in your chart? What does this stuff mean? And what are the things that you should learn about so you can talk to your doctor about it? Your doctor is going to be diagnosing and treating your disease, but it's really helpful if you become educated enough to be a partner in that conversation, because you don't necessarily get the care you need. You either get standard of care or you get what you advocate for. So you need to learn enough so that you can ask the right questions and advocate for yourself. So this is really a tool that helps you advocate, which starts with education. And that's I think that there's a lot of questions about, AI in medicine, and I saw the open AI restrictions. There's really a need for an application layer that I don't, it's not really about guardrails so much as it's about expectations. It's there's a lot of data that in your medical record. You're not going to want to cut and paste that into Chat GPT, and who knows where that goes. It needs to be in a safe, secure, trusted environment, but it
Mhm.
needs to be accessible to the AI. I mean, when we talk to the AI, I mean, we can anonymize the data. When we're first of all that we're using AI models that are HIPAA compliant. But the fact is we can also anonymize the data before it's talking to the AI. It doesn't need to know like who you are, but it's really about like, hey, if somebody has these mutations in their biopsy, what are the things that are what do we know about that? What are the treatment options that might open up? Not that this might be right for you, but it's certainly worth a conversation with your doctor, if all the stars seem to be aligning. So it's about having the right expectations of the AI, and also being very careful in how you manage the AI, recognizing that just like in the real world, there's a diversity of opinions about
Mm.
what might be right. So you got to recognize that there's AI does not have the answer for you.
Right.
What it does is it helps you ask better questions of your doctor.
Yeah. And you know, maybe aligned to that or adjacent to that, there's this typical black box problems when it comes to AI answers, right? You ask the same question multiple times and you get different answers multiple times. Take that, and then also more generic type of, let's say I'm just pulling up my chat GPT and I start asking questions about that little scar I have or whatever, right? How do you solve the black box problem? Do you, or at least put some guardrails on it to have not completely different diagnoses all the time? And how does CureWise differ from those generic GPT health chats or symptom checkers that are available there?
So the main the thing that we're doing that goes beyond ChatGPT is this recognition that there's a diversity of opinions. So let's intentionally go out and look for a diversity of ideas based on your medical record, and then let's look for outliers, and then cross-validate, and let's look for synthesis, places where ideas converge, because that's important information. It's a big black box. You're right, but there's a lot of different pathways through that black box. It's like impossible to reverse engineer the LLM, but you can probe it multiple different times from multiple different points of view and see what comes out. So if you go to ChatGPT, it's actually, it's a kind of a one shot, and it's one kind of linear path through it, and it's actually tuned to kind of be creative in its responses and give you a different response every time. And they actually inject some randomness in that. When we're working with the API and we're doing our own application, we tune all of those things out and get the most deterministic response possible. But the fact is, the context that goes in can be different and can change. So what we intentionally do is we tune it to be as deterministic as possible. And then we specifically, intentionally create a diverse sets of points of view to try to probe it in many different ways, to try to get like a broader range of potential answers, and then look for synthesis. So that's the methodology. It's a mixture of agents and models, because it's all with the same model. It's across models. So it's the buzzwords for it now. It's a mixture of agents and models that we're doing, and we're doing chain of debate. So we're having the agents essentially debate each other.
Gotcha. Got it. And okay, so in your experience so far, I remember when I was, my kids, so I had kids, and then it was about time to give them the vaccines and all that. And I was reading about this, and the typical response from a doctor is like, "Oh, well, here's another one with WebMD," or I had something myself research. Generally, I have the feeling that doctors don't really appreciate when a patient comes somewhat prepared, which is understandable because you don't really know where they're taking the advice from, and then it leads to friction. What has been the response so far from that perspective?
Yeah, in some ways I was kind of expecting that, oh, my doctors are going to hate this, but actually that didn't happen. I think that, maybe it's different with cancer because so many of the treatment decisions are kind of like they are in your hands. Hey, do you want to do this? Or you want to do that? There's pros and cons of doing this. There's pros and cons of doing that. So there's a little more of a need for kind of collaboration and conversation about that. So, and it's a serious disease, and it's, like 600,000 people are going to die of cancer this year. So, it's like it's not, like getting your tonsils out. It's like it's more complicated. So I'd say, on one hand, there's more room for conversation because it's complicated and there's a lot of decisions that have to be made. But the other side that kind of puts pressure on this is that there aren't enough oncologists. There's a shortage of oncologists, and there's a rising rate of cancer. So, there's a lot of pressure on the system. So, I kind of say, like, look, if you're only going to get 10 minutes a month with your oncologist, how do you make every minute count? You make every minute count by educating yourself. It's not like I'm coming in with a whole pile of stuff from the internet. I'm rehearsing the conversation for a couple of hours before I go into the doctor, so I kind of like know what I'm talking about. I've kind of asked all the naive questions. I've gotten myself to a more focused, better point, so I can use that time really wisely.
Mm. It's fascinating, and also on a personal level, I think this is not really a mission that you chose. It's more something, the mission that chose you in that sense. But what I'm curious about is when did this stop being a one-off survival project for yourself and start to feel like you were responsible to build something for others in your situation and similar?
Well, when I first got diagnosed, my first kind of self-limiting belief was, okay, that my career's over. Like, no one's going to invest in a 60-year-old startup entrepreneur who has just got cancer. But and I wouldn't, everything, all of my plans were like, gosh, I shouldn't have any plans right now. As I started to get better and what I was doing started to work, some of I knew a lot of people in the medical field because I was in the medical field for a long time. And I went back to a lot of people I know and I said, look, here's what I'm doing. And, do you know anyone at UCSF? Do you know anyone at the Mayo Clinic? Do you know anyone at UCSD, which is the closest place to where I am here? And, I'm sort of working my network. And some of the people I know say, Steve, that's really interesting. Yes, I'll introduce you, but I'm also doing this conference. Would you be interested in coming and speaking at my conference and telling everyone about what you're doing? And I went and I spoke at this conference called Next Med in San Diego, and showed what I was doing. And it brought somebody else who's now on our team who did use CureWise with her own breast cancer. And the questions from the audience were like, how do I get this for myself or my family? And the other question was, how do I invest in this? So I realized people really, this was really touching a nerve. There's a real huge unmet need here, and people want to back it. I was still at that point where I didn't know if I was going to be healthy enough to even think about doing a startup because it takes a lot of energy to do that. But as I got to a complete response, a complete remission, and as the treatment options, that's what I was doing, started working, I realized, yes, I actually can do this. I can recruit a fabulous team. I can raise some money. And it's, everything's just been kind of flowing since then. I was Before this, I was, say, throwing a lot of spaghetti at the wall with AI ideas, and it was all sticking. It's like, I don't even know what I should do. Everything seems like a good idea.
Yeah.
But this tsunami of AI is hitting every industry, and there's just opportunity everywhere to make things better using AI. It's just phenomenal time to be an entrepreneur, but you got to pick, what part of that tsunami are you going to surf? And it's like, you know what? The wave that's right under me right now is this one.
Yeah.
Uh, but I had been in healthcare for a big part of my career. Then I stepped out of it because I kind of got tired of the glacial pace of healthcare and the fact that everything ended up being sort of politics rather than science. I needed to get an act of Congress passed. I mean, all kinds of stuff. It was very hard to do the right thing in healthcare back when I was doing it. I'm like, no more healthcare. So I became a filmmaker. I did something else. In film, there's this kind of construct of like the hero's journey where, you have the call and then you resist the call, and then finally something happens and you say yes, and then you go on, then all kinds of trouble starts as you go on that adventure. I feel like, yeah, I was sort of resisting, but my house burned down, I got diagnosed, and then I started doing the stuff with AI and it started working, and then I got better. It's like, okay, I'm all in on this now.
Yeah. Wow. Yeah. I mean, when it rains, it pours, right? Everything at once. On the topic of AI opening up so many opportunities, I feel like I have ADHD or ADD, I don't know which one, from AI because there's so much you could do with it. It's insane. But to wrap things up, I wanted to touch on something you kind of mentioned, and that's the glacial pace of the healthcare industry, so to say. If you had a message to the stakeholders, like the healthcare leaders, policymakers, corporate decision makers, when it comes to AI in medicine and maybe for your own solution, what advice or what ask would you have to these people in order to really leverage this technology as much as possible?
Right now there's a lot of fear mongering around AI, and I think a lot of it is really gaslighting and not really accurate. It's based on kind of a misunderstanding of what AI actually is. And then there's sort of a knee-jerk response among regulators. It's like, hey, we need to regulate all this stuff. And I just urge people to think like this is how we're going to cure cancer. If you do a bunch of stuff that slows that down by 5 years, that's 3.2 million Americans that are going to die that might not have died if we had gotten there 5 years sooner to a cure for cancer. But it tools, AI is going to be the key to solve some of the big grand challenges that we're facing as humanity. And let's not lose sight of that. Let's try to be really clear-headed about it. So I think that's the kind of the broader message. With respect to the glacial pace and healthcare, it's moved slowly because the stakes are high. It's
Mm.
like it's a $5 trillion industry. Every little thing you change could have these huge repercussions. So, I understand the stakes are high, but as an entrepreneur, I said, okay, look, I already did that where I had to go to government and payers and insurance and do all that stuff. I'm not doing that again. I'm going straight to the individual. I'm going straight to the end user. And we don't have that glacial pace. The end user, it's like they want answers now. And the fact that it's possible to do so much more with less now with AI, that it's possible to create a business that goes straight to the consumer and actually is successful. Where before, when I was trying to do this, everything was too expensive. We couldn't make it work that way, but now we can. That's the solution to the glacial pace. It's like, we're not going to go to the institutions. We're going to go straight to the user.
Bottom up. Love it. Steve Brown, thank you so much. If people want to sign up for the beta, if they're allowed to, or if they want to connect with you, what's the best way?
Yeah, so go to curewise.com get on the wait list. We are inviting you. You have to fill out and say, hey, here's why you should pick us, pick me. But we are inviting people in, and we're going to expand that through the end of the year. And then in January, we're going to open it up to everyone. But the people who sign up now, we're going to get them in earlier. We're going to give them a bunch of extra credits and things. So we're going to make it worthwhile to sign up. But it also really helps us understand what the needs are by getting on the wait list. Plus, we are inviting people in from the wait list.
Okay, great. Yeah, we'll definitely link all this in an article below. So, Steve, again, thank you so much for coming on. This is inspirational. I hope everything goes well for you and for CureWise. And yeah, looking forward to stay in the loop on this project. It's exciting.
All right. Thank you, Camille.
Thank you.
Welcome, welcome to the club. AI adopter. Welcome, welcome, welcome to the club.